Okay, hi, my name is Savanna, and today I'm going to be discussing pharmaceuticals. So pharmaceuticals are seen as having negative effects in both humans and animals, and also being addictive in humans. Jay Woodcock, he's an FDA administrator, stated that in the 21st century there has been a growing awareness for the significance of the quality of pharmaceuticals, and that the pharmaceutical industry is one of the most closely regulated industries in the past 50 years. So a major claim that I'm supporting is that pharmaceuticals are beneficial to mankind. The three reasons being: 1, prevention of disease; 2, treatment of previously untreatable diseases, meaning there's no solution; and 3, pharmaceuticals prolong life until other options are available, meaning there's a solution but we're unable to get to it at the moment. So the first one, prevention of disease, this is probably the most important because it saves lives in the past, present, and the future. So vaccines are important because they bring the risk of widespread contagions down, giving us diseases that we don't need to worry about as much anymore. These include polio, measles, and mumps. So WebMD, which is one of the top online healthcare websites, states that polio is eradicated in the U.S. due to the IPV vaccine, which is given to children, and usually it's required before children can go to school in most countries. And then that measles and mumps are resolved due to the 2-time process MMR vaccine shot. So diseases are easily transferable, as we know. We all move around the world through plane, car, and train. And these are especially dangerous for kids, older people, and HIV patients because of their weaker immune systems. So a study conducted by researchers from the University of Washington, they examined death records and population counts from the National Center for Health Statistics and U.S. Census Bureau, and found that in the U.S. today, 16 diseases are now preventable because of childhood vaccines. So with that being said, we know that diseases aren't always prevented, which brings me to my second statement, which is treatment of previously untreatable diseases, meaning that there's no solution, but we can find ways to help it. These include cancer, HIV, and cystic fibrosis. So cystic fibrosis is a hereditary disorder where mucus prevents the release of enzymes that allow the body to break down food and absorb vital nutrients, which ultimately leads to respiratory failure and death. So the claim above, basically, it freezes like the diseases, and then if you don't freeze the disease, then you basically die quicker, and so these halt time for us. So in 1987 to 1994, the first effective treatment renews hope for many people. In 1987, researchers proved that nucleoside reverse transcriptase inhibitors, which is long for NRTIs, slowed progression of the disease in advanced cases. So for the first time in over a decade, infected patients began to imagine a brighter future. So, and then the CF Foundation, which is Cystic Fibrosis Foundation, was created in 1995 by parents, or a couple of parents, and then this foundation ended up creating the Research Developmental Program, which is a dynamic interdisciplinary research center network to accelerate more understanding of cystic fibrosis and complexities of the disease. This foundation found that breakthrough treatments have added years to cystic fibrosis patients' life, and today the average age is 40, which is a huge improvement from the 1950s when children would rarely live long enough to attend elementary school. Some treatments for this include inhaled medicines and pancreatic enzyme supplements, which help with vital nutrients. And in 2015, the US FDA approved the second drug to treat the root of cystic fibrosis, which was a defective protein called CFTR, and they signal a historic breakthrough in how cystic fibrosis is treated, and it is expected to add decades of life for more patients. And the next one, which is quick, is HIV. We all know the virus that leads to AIDS, which is the last stage of the infection. And without this treatment, it's said that the average survival time is 9 to 11 years. And in 1995 to today, protease inhibitors which is a class of antiviral drugs, have halted the growth of disease by preventing infected cells from duplication and spreading the HIV virus. So other drug treatments of this include nucleotide analogs, fusion inhibitors, CCR5 receptor antagonists, and I know it doesn't mean much, but these have all restricted replication of HIV and prevented it from entering into more cells. So pharmaceutical companies are currently developing more than 40 new medicines to treat and prevent AIDS. And according to Anthony S. Fossey, which is the MD director of the National Institute of Allergy and Infectious Diseases, states that one, HIV death rate has decreased by 67%. Two, today a 20-year-old with AIDS is expected to live till 70. And about 862,000 premature deaths have been avoided. And finally, the HIV fertility and survival periods have only gotten better due to medication developed, the medication that has been developed. Which leads to my third and final statement that pharmaceuticals prolong life until other options are available. And this means that we're unable to get to it at the moment, but there is a solution. So surgeries and intensive therapies are always available, but some people are too disabled or sick or don't have enough money for those options, and some people are even too sick to survive those big surgeries. The study mentioned earlier that was conducted by researchers from the University of Washington found that in the past 35 years, deaths from infectious diseases have lowered by 19%, such as meningitis, respiratory infection, HIV, hepatitis, and tuberculosis. In conclusion, the benefits of vaccines and medicines that interact with the human body prolong and improve life by eradicating diseases that have plagued mankind in the past few centuries. Thank you.
No, you gave me an outline, right? No, you didn't.
I gave it to the other person.
Well, you're going to give me one later,
Okay.
because apparently you cut your notes up. Well, I know what your topic is, and I think you need to give us a little bit broader explanation as to why it is you have to defend pharmaceuticals. It seems to me like most people would think that, yeah, pharmaceuticals have made a difference, so why is it that what's the argument here on this? I think you need a little bit more context to show a controversy that there is, in fact, a wide variety of people who criticize the pharmaceutical industry as being exploitive, as being hiding information they're not particularly transparent, engaging in practices that they see as being dangerous and problematic, and some people even try to minimize the impact that the pharmaceutical industry has had on the overall health of the world or Americans in particular. And that's why you need to make this argument. As it is, I think it comes across a little bit more like a list of the greatest hits of the pharmaceutical industry of the last 70 years, which is not necessarily a bad thing, but why do we need to have that? That's the thing that justifies making this an argument. There is a good layout of what the content's going to be. We've got a preview structure that's pretty easy to follow, and you signpost that well during the body of the speech. That's fine. I do want to point out that the whole third point, though, occurred in overtime, so that feels a little bit like maybe it wasn't appropriately distributed on the first couple of points, and maybe you spent a little bit too much time with providing examples, especially on point number 2. There's a lot of evidence that talks about the impact of vaccines on the general health of the population. I think that could be summarized a little bit more quickly, but you had good evidence there. The cystic fibrosis argument on the second point and the protease inhibitors also on the second point seem to suggest that there is progress that's being made and helping people along with the current situation. Even if it doesn't cure them, it extends their life, and I thought that was a pretty good argument to make. And you had some good statistics that you said, look, the average age that people might have been expected to die after having AIDS, for instance, or acquiring the HIV would be a short years after they acquired it. Now they're expected to live to age 70. That's a substantial difference. We're talking about 70,000 lives a year each year in the United States. By the way, you could also talk about worldwide. There's been a substantial impact on the AIDS epidemic in Africa as a result of increased access to these kinds of medications. And I think that the notion here is that, look, there is something being accomplished by these agencies. Every time somebody criticizes them for being, gouging the public or for supposedly hiding some, I get a little sick of the notion that the pharmaceutical companies are the ones responsible for suppressing marijuana access. There are lots of reasons that it's suppressed, but the pharmaceutical industry has little to do with it. But they are often used as a boogeyman for people who are critical of the way the FDA makes decisions. But this is one of those things where you say, look, they are accomplishing things. They've got information that they can document to show that they're making progress, and that's why we ought to be a little bit more considerate of them and not as critical of them in the long run. The reading is occasionally a little bit awkward. It could probably be better if you were a little more familiar with the argument and could talk to us more in a direct manner. And like I said, it's a little overtime at the end. All right, thank you.